Welcome to Gibson's Caring Corner. Today we're going to be talking about the difference between home health and home care. There's a lot of confusion when it comes to which one does what. So Creighton, can you tell us a little bit about home health?
So, home health care, they usually have skilled care. They come in after the hospital stay. They have therapists and RNs. It's usually covered by Medicare, Medicaid, sometimes private insurance. But the patients must meet the eligibility criteria.
And home health is prescribed by your general practitioner. So what happens whenever you're in a hospital, and a lot of times you have a discharge planner, you should have, and then the discharge planner says, oh, who's going to provide care for you whenever you go home? And a lot of times our seniors go, oh, I can provide care for myself, when they can hardly walk. And then whenever they get home, they're like, what are we going to do? I need help. So that's where home care comes in. Medicare does not provide for home care. Home care is the meal preparation, light housekeeping, doing the laundry, changing the sheets on the bed on a regular basis, making sure your environment is safe, clean, and you get the nutrition and medication reminders that you need. And if it needs to be provided in conjunction with those discharge planners whenever they're coming out of the hospital. You know, we had a call just last night. Another person discharged from a hospital, went straight home, and they couldn't even get out of their off of their chair or their sofa by themselves. Yep. And the children are like, what do we do? So it's a problem in our communities across the board.
So some of the other things that home health care does, the length of care will depend on your needs. The eligibility, you'll have doctor's orders. The home health company will come in, they'll visit a few times a week, a few days a week based on the doctor's orders. It could be up to 90 days. They provide physical therapy, occupational therapy, speech therapy, IV therapy, injections.
So that's perfect. You know, things that home care does that looks like home health, in those 90 days, they will come in a couple of times a week and help with bathing. Mm-hmm. But after that 90 days, that ends. You know, home care, they're experts at giving those baths. That's what they do all the time with their clients on a regular basis. And the things that pay for home care are veterans, VA administration, Medicaid pays for home care. We also have long-term care insurance that pays for home care, and Council on Aging pays for home care, and of course private insurance and private funds.
Yeah. So, like us, they can provide care in the home, assisted livings, group homes, things like that. Other things they do is medication management, which they can take the pills out of the bottles, actually put them in Monday through Sunday containers. And then when we come in as home care, we can take them and pop open Monday and say, Miss Smith, time to take your medicine.
So just a reminder, he's home health today, I'm home care. So injections only given by home health. Mm-hmm. That would be insulin for diabetics. That could be antibiotics. That could be IV infusions, only home health. And home care can remind of medications, where home health can fill the Monday through Sunday containers. Home care can just flip open those daily containers and say, here's today's medicine that's already been pre-measured by the professionals in home health. Right. So the things that both organizations do that are alike, are very similar, is the goal is to keep the patient safe in their own environment. So that's important and key to both organizations. Mm-hmm. They are very concerned about the care provided in the home, and the care is tailored to meet the needs of the patients. Help with bathing, dressing, and grooming is provided with both, and reminders to take medications is provided with both.
Right. But again, it's under doctor's orders for home
Yes.
health.
Yours is under doctor's orders, and doctors may not release a patient home unless they also have the home care side. But it's technically, I don't know, maybe it's like a doctor's order, but the doctor can discharge our clients even though they're not a part of our structure as far as home care, but they can discharge them from our plans. So that's a little bit crazy on how that works. There's some gray in all of that arrangement. But with that being said, I know we had talked about the possibility of someone from a licensed home health company coming on and talking on a podcast. Were you able to get that set up?
Working on it. Hadn't got a phone call back yet, but possibly soon.
So that'll be a goal, that in the future that you'll have a professional from the home health industry that will come and talk to you about what all they do in addition to what we mentioned today and how we partner with providing care for our aging adults.
Yep.
Thank you for joining us today on Gibson's Caring Corner.
Hi, welcome back to Health Tips with Cale, your exercise science and health and well-being enthusiast. So today I'm going to talk a little bit about being sedentary and then working away from being a sedentary lifestyle to working out and having a little bit of exercise. And so we're going to talk a little bit about the benefits of exercise and also the types of exercise that we can start doing, especially for those that are in a home situation where they can't get out to the gym, or for your 65 and older group too. So a sedentary lifestyle, what is that? Well, a sedentary lifestyle is just a lot of sitting or lying down. So watching TV or maybe sleeping throughout the day or reading a book. Those are all things that are kind of a sedentary activity. Sedentary activity has also been defined as anything that is less than 1.5 METs. Okay, well, what's a MET? A MET is a metabolic equivalent activity. So how is METs defined? Well, METs is just the way that scientists have used the average amount of oxygen used per each activity. So a human normally needs about 3.5 liters per minute of air for certain activities. And so they've actually defined that as 1 MET. And so going from that, they've actually started working out, okay, so these certain activities use up this much oxygen or this much air in order to fully function and use that, or to be able to do that activity. And so those activities have been used for METs. METs has also been used for counting your caloric deficit, but that's really not the best way because a lot of times there's a lot of factors that influence that. So METs is a really great way to just kind of, I would say, kind of compare different exercises, see, oh, is this a good exercise for me? Is this not a good exercise? Should I be doing more of this or less of this? And so on and so forth. So sedentary lifestyle, so that all really kind of, well, you're kind of all maybe saying like, well, what's wrong with sitting down? I mean, sometimes we need to rest. We have to sleep 8 hours a day. What's wrong with sitting down, and so on and so forth? Well, sedentary lifestyle has actually been researched to increase all risk of mortality. All mortality ratio or rates have increased. So things like cancers, diseases, diabetes, obesity, heart disease, hypertension, everything that you can think of that we're having issues with today, that has all been linked with sedentary activity or a lifestyle. Now, it doesn't necessarily mean every time you sit down, oh, there I go again, I'm not going to get diabetes or I'm not going to have hypertension or anything like that. No, obviously we need to sit down, we need to sleep 8 hours a day and so on and so forth. But it's really coming from that and then trying to work out more and sitting less throughout the day. So instead of sitting for 16 hours a day or 8 hours a day, maybe try moving a little bit more. So maybe you're sitting for 4 hours a day instead. So with that, what are the benefits of exercise? Well, everything that sedentary lifestyle increases, exercise actually helps to reduce. So your hypertension, high blood pressure, your anxiety and depression. Exercise helps wonderfully with your mentality and anything cardiovascular. So it also helps with other mental functionality, so focusing, helps with your memory, your thinking skills. It also helps with weight gain prevention and weight management. And so we'll actually have a later thing on weight management in another week. So going back to kind of METs, what are some great exercises that have been scientifically proven to help us get away from that sedentary lifestyle? Well, anything from a 1 to 4 METs, and you might not even look this up later on, but just to kind of give you an idea, is considered low intensity. So cycling at less than 9 miles per hour is considered low intensity. That's just maybe going for a bike ride down in the park somewhere at a very slow speed. Playing video games, reading a book, or going for a slow stroll, or walking, anything less than 2 miles an hour. So if you're walking and smelling the roses every time you see a nice little flower, you're probably not doing too hot on burning some extra calories, but at least you're outside and enjoying the sun, which is great. Anything from 5 to 8 METs is considered moderate intensity. And this is where you really want to try and focus in, especially if you're just starting out with working out. So walking, anything over 2 miles an hour, that's a great way. So having a walking plan to say, hey, this is my time to exercise for 30 minutes a day, and trying to really push that walking pace a little bit, and maybe not stopping every time you see that flower. From there, also swimming activities or water aerobics. Water aerobics are phenomenal for elderly patients or elderly in general. Gardening and digging. Gardening has been, I would say gardening is one of the most beautiful activities you can do while staying at home. It doesn't seem like you're doing too much, but when you're really having to pull out that one weed that just does not want to come out, and you have to grab the rake doesn't work, then you have to grab the spade or your little treadle, and all that doesn't seem to work, and you're really just struggling with that, it burns a lot more calories than you think. But so does even taking the time to put in that new plant once you get that weed out of the ground. And then from there, anything over 8 METs. And so with this, we're looking at mountain biking. We're looking at cross-country skiing. We're looking at people that are going out and racing. So your 5K runners on the weekend or during that turkey trot that normally you might see them far, far ahead and the gun has already just gone off and they're already halfway done with the race. Those guys, they're probably burning off, they're probably doing more in high intensity. So with that, if you're just starting off and you're a little bit on the younger side, whether you're a teen, you're in your 20s, 30s, 40s, 50s even, just finding a nice group to join. Like here, I actually just went to an F45 group class today. That was phenomenal. But that was a little bit more on the higher intensity. But even with that, you can still even kind of tone it down just a little bit and work it at more of a moderate intensity. But just doing things like walking, maybe going for a jog or going for a swim. But definitely finding a group class, I would definitely recommend. Or maybe even trying to find a personal trainer at your gym. Now, for those that are 65 and older, last week we kind of talked about how they need to focus on their strengthening and their balance skills. So with that, doing things like squats, sit-ups, back leg raises, calf raises, push-ups, using things as chairs to help you with those mobilities, or using a wall. So you can use a chair to hold on to as you go down for a squat, or even just sitting down into the chair and then getting back up and then sitting back down to the chair again. That's all great. That's all great ways to help out. And if you have to use a cane or something to help balance you, then please do so. The last thing we want is for you to fall. But doing sit-ups. So another thing is sitting up in bed and then laying back down in bed. It doesn't seem like it's doing much, but just making sure you sit up and then lay back down. That's a great way to work your core and your abdominals for sit-ups. From there, back leg raises. So using a chair and just raising a leg up behind you. Calf raises. So using a chair once again. And so just holding onto the chair and then just raising yourself up onto your toes. It doesn't have to be anything too strenuous or too stressful, but just really trying to go for more reps. So 12, 15 reps of each would be a great way to start. Don't overdo it. Don't try and force yourself if you're getting really too tired, but just try and do it at a good pace overall. And push-ups. You can use a wall and sit there and just push yourself up like this. Anything to get your body moving. That's really what we're trying to look for. And once again, water aerobics. Water aerobics is phenomenal. It's a great way to socialize, get inside a group, and it also uses water to help counterbalance the weights that you might be using while still allowing you to move. So I just want to clarify. I did make a mistake. So a MET is not 3.5 liters per minute. It is actually 3.5 milliliters per kilogram of body weight per minute. So if you weigh a little bit more, you're going to be using up a little bit more oxygen than somebody that weighs a little bit less. But it is 3.5 milliliters per kilogram of body weight per minute and not 3.5 liters per minute. I just want to make sure I clarify that. I caught my mistake. So sorry if that confused anybody. And that's it for today. Thank you for joining Health Tips with Cale.
For today's edition of Let's Go Back Through Time, the stories of Elizabeth Anne Rinehart Gibson. Here we go. After all the food you could eat, you made a run from a freezing cold dining room to the fire room to hug the fireplace to get warm. The wood-burning kitchen stove felt good as you washed up in a washpan atop the wood box in the kitchen. Alongside the water table with 3 to 4 buckets of water with dippers or gourds for getting a drink or dipping water into washpans. Old iron kettles were always on the eyes of the stove to keep water hot for washing dishes, shaving, etc. After eating such an enormous breakfast, one would just know there's no way one could want anything at lunchtime. Wrong. At lunchtime, or dinner for us at noon, might be big iron pans of pinto or white beans with big cuts of pork for seasoning, or a ham hock cooked all morning to go with a batch of turnips or mixed greens seasoned with pork, served with vinegar. Mother cooked many good dishes. The deep dish fruit pies with a sweetened milk dip was among the favorites. Always molasses cake, tea cakes, and potatoes, sour yeast bread was delicious, and I reminisce of such good eating, realizing never again will those treats be. Those 2 meals had enough calories filled with unknown amounts of cholesterol and other unhealthy unknown goodies packed into every bite. So doctor says, no, that's not a good idea. All right. Following the horses with the plow, hoeing or picking cotton, corn, molasses cane, the garden, or any other chore needing to get done certainly took care of the many calories we stuffed ourselves with. Now, we've had 2 meals already and the supper meal is yet to come. Hot cornbread with milk and onion and leftover vegetables and dessert was our supper. We always finished each meal with butter and homemade molasses. Remember the grain kettle and the threshing machines? Mr. Holcomb had the last threshing machine in our community and threshed our grain. There was always 10, 15 men making up the crew of farmers trading work. Many women got together to cook for all the crews. Each housewife did her best to be the very best cook in the community. She always used the best cuts of country ham, fried chicken, vegetables, cakes, pies, and bread. Every man on the crew always had at least 2 helpings of everything. Once Mr. Holcomb let me ride on the running board of his old farm truck from Alice and Jack's house. And I stood on the running board holding on for dear life, afraid of falling off. He stuck his head out the window of the driver's side and asked me if I would like to see a monkey. Stupid and naive as I was, of course, I thought he really had a monkey and said, "Oh, yes." He said, "Well, look right here. Yes, there's a little blonde-headed monkey in that mirror. Me." He called his monkey from then on. I was called his monkey. I was so embarrassed. Talking about cooking enough food for the threshers, it seemed to me every Sunday would always bring many visitors of family and friends, enough to be threshers, and Mom cooked all Saturday and Sunday for Sunday dinner only. For me to always have to wait to the second or third setting of dinner, how awful it was to miss the best cuts of ham and chicken legs. Remember? One of our neighbors, Sarah Ketchy, would tell the funniest story about her future husband, Oscar Belk. taking her home with him to eat Sunday dinner and meet his family. The family was large, and as all sat around the table with the father of the clan sitting at the head of the table praying over their meal. Oscar was filling Sarah's dinner plate as high as he could. Remember, this is why everybody's praying. Amen finally came around, and Oscar looked over at Sarah and said, "Sarah, could you not wait till we got finished with our prayer?" Needless to say, she could have killed Oscar. And that's the end of today's story time. I hope you enjoyed it, and we hope to see you back next time on Gibson's Caring Corner.
Thank you for watching Caring Corner. Make sure you head over to our Facebook and YouTube channel where you will find this program along with others. Be sure that you subscribe, like, and click the notification bell so that you will receive notifications for our weekly program. Don't forget to share this program to your social media platforms. If there's a question that you would like to ask, make sure to email it to caringcorner22@gmail.com. We hope to see you on the next episode of Caring Corner.